Hello, everybody, and welcome to Premera Blue Cross's Managed Care Residency webinar. We want to thank everyone for taking time to get to know our program a little bit better. Today, we'll have 4 speakers, myself, Max Lee, my counterpart, Kyle Bakkie. We are the current residents for this year. We also have joining us a past resident from 2 years ago, Dr. Emily Sao, who also is on the clinical team currently, and also Dr. John Watkins, who is our program director. For the agenda today, we'll go over a brief background about our academic and career trajectories, a little bit about Premera Blue Cross as a company, go over the program features, some of our longitudinal and block rotations, and close out with some of our tips for the application.
Hi, everybody. So my name is Kyle. Like Max said, I'm one of the current residents for this year. I'm just going to share with you guys a little bit about my background. So as you can see, I am from California. I went to pharmacy school at California North State University College of Pharmacy, and I concurrently attended Sacramento State University and got my MBA from there. I started out working at Rite Aid in retail pharmacy, and I know when I worked there, the whole idea of even prior authorization just kind of stumped me, and no pharmacist could really give me a good explanation. I just kind of thought it was, insurance companies being evil, not wanting to pay for medications. That was actually, so then I had a rotation at a small health plan in Sacramento called Western Health Advantage, and I definitely learned a lot more about managed care during that rotation. I learned, that prior authorizations have their purpose. They're there to help lower drug costs for everyone, and they are based on evidence-based medicine. And that's, really where I got, my interest in managed care, and decided, that a residency was definitely for me. And also you see APHA there, definitely heavily involved with APHA and expanding the role of pharmacist while I was in school. And that was my journey to my current residency at Premera.
Thank you, Kyle. And like I said, my name is Max Lee. I'm originally from Portland, Oregon. So I did my undergrad degree at the University of Oregon. And then after graduation, I started work as a pharmacy technician at the Oregon Health and Science University, or OHSU, which is a large academic hospital there. And on the inpatient side, I was able to see myself in the shoes of a pharmacist. And then that later got me to attend the Pacific University of Oregon School of Pharmacy. Immediately following matriculation, I did a lot of research about where a PharmD license could land me in terms of practice settings. And that's when I came across non-traditional pharmacist roles. It appealed to me initially because of the merger between sort of the business aspect of healthcare, but close to the innovative sciences and drug development side of things. Once I got into school, I quickly took on a lot of extracurriculars that I knew would help develop my skills that would make me marketable for residency in this area. So I did a lot of involvement with student leadership in AMCP. That's how I got introduced to the PNT competition, which also gave me an introduction into the daily work that managed care pharmacists do. I later went on to an API rotation at Moda Health, which is a regional health plan in Portland. There I got firsthand experience on the different operations and departments involved. And I was also able to do a side project relating to quality initiatives, which led me to national conferences. And that gave me opportunities to network and be introduced with Premera. I'll leave it at that, and then we'll move on to Dr. Emily Tsao.
Hi, everyone. Just wanted to give a big thank you to everybody who's currently listening to this for your time and your participation. My name is Emily, and I'm a clinical pharmacist within our clinical team in the pharmacy department at Premera Blue Cross. I started out my journey as a pharmacy student at Auburn University in Auburn, Alabama. Through my time as a pharmacy student, I had the opportunity to do an internship with the FDA, spend some time at the Johns Hopkins Hospital in Baltimore, and then also do a rotation at Eli Lilly in Indianapolis. These 3 experiences really shaped my interest in managed care, wanting to understand the value of drugs and that led me to pursue a managed care residency and ultimately match with my first choice, which was Premera Blue Cross. As a result of my residency and the great experience I had, I ended up staying on as a clinical pharmacist, and I currently oversee utilization management for pharmacy and medical benefit drugs.
Thank you, Emily. And next we'll move on to Dr. John Watkins.
Hi, and thank you to all of you for joining us. If any of you were on the previous live webinar that we had technical difficulties with, we apologize. Here's the content we were planning to give. So my story obviously is a lot longer because I've been around longer than they have. Like a number of our pharmacy students, I didn't start out to be a pharmacy major. I had 2 degrees in chemistry before I found the light. Did a term in the Navy in between. This was in the late stages of Vietnam, so it was not totally voluntary. Came back and was at the University of Washington when I started learning about pharmacy. Happened to be dating a pharmacy student at the time, and I thought, man, this sounds interesting. I need to check it out. And I never looked back. So I graduated with a bachelor's in '79, worked for a couple of years in a retail pharmacy on one of the islands in Puget Sound. It was a nice way to spend a couple of years, but I could see that that world was not going where I thought I wanted to. I then went to Portland, did a year's program at what's now Multnomah University, and worked part-time in a hospital while I was there. I was intending to go overseas as a pharmacist missionary, and I knew I needed hospital experience. They were nice enough to hire me. And in 1983, we moved to Nepal, where we spent the rest of the 1980s and ran a hospital pharmacy there for 5 years. And then the last 2, I was working in a centralized program that imported and distributed medicines to 30 plus projects around the country. Came back in 1990, and so I did this out of order. It was at that point that I did my residency. It was what they at the time called a 2-year academic residency. It was ASHP accredited at Group Health Cooperative, which is now part of Kaiser Permanente's system. At that time, it was independent. It's actually a separate organization that started at about the same time as Kaiser, and they were kind of kindred spirits in my day, and then eventually ended up merging. So after I completed the residency, I was an inpatient gen med pharmacist for a while, and then did drug information in the pharmacy administration team for the last couple of years I was there. Spent 3 or 4 years at Regents Blue Shield in Seattle, where we were at that time developing and piloting what you now know as the AMCP format. And I was then hired at Premera, where I've been ever since. And I've worked with what at that time was FMCP, now is the AMCP Foundation, since fairly shortly after that. I also have involvement with ISPOR, with the Blue Cross Blue Shield Association, and am faculty in the School of Pharmacy at UW. So that's my long story. I think the main take home for you folks is be prepared to change a lot. Even as static as the world used to be, you see I've done several different major things. Chances are that will be more true of you. If you do this residency, we'll try to help you develop skills and an approach to your career that will facilitate your being able to do that, and be ready for whatever happens, and be ready to help solve the problems, because we need all of you. We need you badly.
All right, thank you, Dr. Watkins, and thank you for those words of wisdom. Next, we'll transition into sort of a list of commonly asked questions that we get, starting with the first one. Going into residency, what were some of your goals and how have these changed now that you are about halfway done? So I can start off by saying that my intent in pursuing a residency after graduation was to become a well-rounded pharmacist. And obviously I succeed in a structured environment, which the residency curriculum offers. I also wanted to taste test the different roles within a health plan to see if they would fit and appeal to my career trajectory. And so I believe I got that, and even more so, I think I severely underestimated the breadth and variety of pharmacist roles that exist in this managed care space. And so that was a constant surprise. But as Dr. Watkins outlined, I think my focus now, halfway through the residency, is that I'm witnessing a lot of moving pieces and changes in this landscape. And the focus is now to have translational skills that are will help me succeed in whichever role opportunities arise. And so just being well-rounded in that sense and adaptable has been my focus now.
Yeah, thanks, Max. And I'll take a go at this question as well. So kind of to echo Max, going into residency, I really wanted to get a diverse experience of all of the different roles that a pharmacist can play within a managed care organization. I also, it was a personal goal of mine to apply the skills that I learned during my MBA program and help develop those skills as well. Now that I'm about halfway through my residency, I can say that I've definitely worked at both of those. In terms of, diverse experience, I have completed about half of the rotations so far. I've definitely developed, preferences for some of the work that I do, but I'm still keeping an open mind for the rest of the rotation. And in terms of developing my management skills that I developed during my MBA, definitely had ample opportunity to work on those. I've had lots of projects where I work with our clinical pharmacy manager. And then also my major residency project is also related to quality improvement, process improvement, and management as well. So that's where I'm at so far in the residency program. And then I'll hand it back to Max for the next question.
All right, thank you, Kyle, for that. The next question is, what are some skills that have made you successful during residency? The obvious answer here, I would say, is time management. I think there are multiple deadlines that you're working with at any given rotation, both short-term and long-term. And so your ability to prioritize different deadlines and make work and compartmentalize which ones are urgent and which ones are more fluid, I think is a definite skill. That's a constant challenge for me as well. Another thing is your ability to be resourceful. I think especially in this new corporate environment, you're not only relying on yourself and the pharmacy team, you're oftentimes working with the financials and also the analyst team. And so being able to know where in the company to go for the right answers is going to be important for you to get the information quickly and whatnot. So I'll leave it at that for now. Then the next question here is there room for upward movement for pharmacists within the company? And I'll let Dr. Emily Tsao take this one.
Yeah, absolutely. Thank you, Max, for the question. I would say that there's definitely room for upward movement for pharmacists within a managed care organization. And, when I was applying to Premera as a pharmacy student, I had the opportunity to meet someone within our organization called Chad Murphy. He is a pharmacist by training and has previously been a resident and has over the years, worked his way up through Premera and is now our chief clinical officer and really is sitting at the highest level of leadership within our organization. And so I think for me, Chad is a great example of just how far a pharmacist with a managed care background can go. And for me personally, I find that really inspiring.
Thank you, Emily. And the next question here is, how likely is that a resident gets a full-time offer upon completion of the residency? And John, if you're able to shed some light on this.
Sure, and of course that's the question everybody most wants to know, and it's the question that nobody can give you a definitive answer. However, we're doing very well so far. This is our 4th class that we're recruiting for, so we have 4 graduates. 3 of them work at Premera, and the 4th one works at MODA. So we have succeeded in placing all 4 of them essentially immediately out of school, so you don't, or out of residency, so that you're not even losing any pay unless you want to negotiate a little bit of time off before you start, which is not a bad idea because residency is a grind, and it's nice to have a pause. But in terms of whether Premera would have an opening coming up, there's no way to know that. It depends on who may happen to leave the company. I have noticed that the hiring managers generally are willing to hold a position for at least a quarter or so if they like you and want to keep you. So there's definitely good prospects, but nothing that I can commit to.
Alrighty, thanks for that information, John. And then the last question here is, what does a typical day of a managed care resident look like?
Yeah, I can take that one, Max. So the answer to this question is, I don't think that there is a typical day for a managed care resident. Every day is, very different from the previous one. And it also kind of depends on what rotation you're on as well. But I'll just try to give, a brief overview of, what the average day looks like for Max and I. So you can count on there to be a few meetings sprinkled throughout the day. Usually those are about a half hour to hour in length. And, the meetings are a mixture of internal meetings, meeting with our external vendors. Sometimes we have presentations from manufacturers presenting new drug products to us. And then between the meetings and, there's blocks of time where you'll be working on both your short-term projects as well as your longitudinal residency projects as well. And then Fridays are designated for prior authorizations. So on Fridays, you'll typically be working on complex prior authorization reviews for pharmacists.
Alrighty, thank you for that, Kyle. And next, we wanted to include this because obviously it's timely due to the coronavirus pandemic. So John, if you're able to shed light on looking into the next cycle of residency.
Yeah, so this is a summary, and this is actually, if you happen to be at mid-year, this and a lot of other things like it are available at our booth, which will be up until Thursday afternoon. So we're currently all at home. We've been at home since, I believe, March 6th. We will be at home for the rest of this residency year. However, Premera is hoping to get back open this summer. And what I'm hearing from the experts externally about projections for the pandemic based on the really nice results we're seeing from the vaccine trials, there's hope that we will be back on campus. My best guess would be sometime in the summer. It won't be earlier than beginning of July. But of course, that is subject to what happens with the virus, and it may throw us a curve too. But I would expect that the majority of next year will be on campus. And hopefully by end of 2021, we'll be hitting whatever the so-called new normal is going to be. That tracks with what Tony Fauci and other experts out there are saying. I heard he made a comment within the last week or so that they're hoping that the NFL stadiums will have fans in them next fall. So if that's happening, we should be up and running. We'll do the best we can under all circumstances. As you can see, Max and Kyle are making progress. They will be able to satisfy all the learning objectives that they normally would. And In closing, every year has its challenges. This just happens to be the challenge we got this year, but there will be others next year and the year after. So that's part of the residency, is just learning to deal with those things, because that's what the next 40 years or however long of your life are going to be like. And it's kind of fun. It's a lot better than back in the days when so many people just did the same thing every day for a quarter of a century and then retired. This at least keeps you on your toes and keeps your brain alive. And I've enjoyed that.
All right, thank you, John. And this is definitely something that we'll be keeping a close eye on as things progress. Next, we'll move on to highlighting some of the distinctives about our company. Emily, are you able to highlight some of the distinctives here?
Yeah, absolutely. I think, from a personal perspective, what I really enjoy about working at Premera is that, they really encourage us to seek quality in our work, work together creatively to solve really challenging problems. And, the reason why we do all of this, the reason why we come into work every day and give our all is because we want healthcare work better, not just for our members, but also for everybody else that we work within the healthcare system. So for me personally, what I've experienced at Premera is that everyone really lives by that motto and to make healthcare work better. We work towards that day in and day out.
Thank you, Emily. Next, we'll go over some quick facts about the residency program and the clinical department.
Yeah, thank you, Max. I can take this one. So at Premera, we have about roughly 2 million lives covered. So Premera is primarily an employer group insurer. So our clients include several well-known national accounts, including Amazon and Microsoft, as well as local companies as well. In terms of lines of business that we serve, we do have Medicare, commercial, and then we also offer ACA exchange plans as well. And then we operate in both the state of Washington and Alaska. In terms of our pharmacy department breakdown, there are the 2 residents that we have each year, and then we have 11 full-time pharmacists, as well as 12 other support staff on those teams as well.
Alrighty, and then Premera Blue Cross, our headquarters is officially located in Mount Lake Terrace, which is about 15 miles north of downtown Seattle. The state of Washington consistently comes up in the top 10 states to live in, Seattle being one of the high appeals to that. If you're into recreation or any sort of pastime, I think having the water and mountains near you and food and music has always been an attraction, and so there's lots to do in terms of work-life balance there. Next, we'll go into some of the program features. And Kyle, if you're able to highlight some of the current preceptors that have gone through the residency programs and their experiences. I believe this was outlined by John previously. All 4 of our residency graduates have gone on to clinical pharmacist positions in the health plan space. So we have a definitely good track record of retention there. And our API students have also gone through our managed care rotation here. This training obviously makes them successful to other clinical and industry-related rotations, which they have gone on to here. And then also to note that 50% of our preceptors have also gone through the residency programs, respectively. And I can say for one thing, a high appeal to committing to Premera was that I can rest assured that I would be supported in whatever my career trajectory is. And so that's a constant reminder through each department that I rotate through. And then some fast facts about our program. Our application deadline for this residency cycle ends at the end of the calendar year, December 31st. And then if you were to be chosen, the start date would be at the end of June for the next 2021 year. Our curriculum is a mix between block and longitudinal experiences. We also offer 2 options for elective rotations, which you will go on to later in the spring. We also have close partnerships with the AMCP Foundation in Virginia, and there are multiple opportunities to collaborate with them throughout the residency year. We also are close with the University of Washington School of Pharmacy, in which residents are offered the opportunity to participate in the teaching certificate course. We also have staffing requirements for the prior authorization reviews, which we outlined as takes up about 15 hours per week. And as residents, you also get opportunities to network and present at the national conferences. And then Dr. Emily Cao will describe a little bit about what our former residents are doing now.
Yeah, absolutely. Like Max and John have mentioned, we have 3 of our current former residents, are working within Premera, myself included. And then we also have 1 former resident who is a clinical pharmacist at Moda Health. For me, and also for my co-resident Jared Tate, we both went on to roles within the pharmacy department that we really enjoy, that really lean into our strengths. And I would say that I think I can speak for both of us when I say that we really enjoy the work we're currently doing. We feel like we're making a difference, and we enjoy the people that we work with as well.
And you definitely are making a difference. And one of the joys that I get from my job is just watching residents get out there and continue growing. You both are off to a terrific start.
Thank you, John. I appreciate that.
And next, we'll go into detailed explanation about some of our longitudinal and block components. Kyle, would you like to explain about your current resident project topic?
Yeah, definitely, Max. So I'll just talk a little bit about the major residency project that I've decided to do for this year and that I've been working on. So currently at Premera, we have multiple different formularies, but our sales team and our client consulting team don't really have a good way of portraying the difference between those formularies to our clients. So one of the projects this year was creating a dashboard that actually various metrics, the differences between our formulary offerings. So that's what I've been working on. I have been working with data analytics, various members across the team. Currently, I actually have a draft dashboard put together, and I'm going to be presenting this to our clinical team on Monday. So very exciting news for this, and definitely happy with the progress that I've been making on it so far.
And then my resident topic for this year is revolving the software technology real-time cost transparency. In this current healthcare model, we note that a lot of patients are abandoning their prescriptions because of the lack of transparency of their out-of-pocket costs until the point of sale. And what real-time pharmacy benefits hopes to do is implement within the provider prescribing process a pop-up window in EMR that allows price and patient-specific at the point of care, so that providers can engage in dialogue with their patients on the best clinically appropriate and affordable treatment options. And this is predicted to improve medication adherence and shift prescribing rates towards more cost-conscious options. And so I believe that this technology has the potential to streamline the prescribing process, and in hopes to submit a manuscript and a talk session at a national conference eventually. And Emily, if you're able to highlight some of the past longitudinal projects that residents have done.
Yeah, absolutely. So I can speak a little bit about my major project when I was a resident. My goal was to leverage and incorporate the reports created by the Institute for Clinical and Economic Review, or ICER, into our existing PNT process and had the opportunity to present my work at AMCP Annual back in 2019. My co-resident Jared also worked on a major project, and his was on hemophilia management, taking a holistic approach to management of hemophilia, and he was able to present his work at a panel to ISPOR in 2019 as well. Wanted to touch a little bit on our former residents from this previous year who did great work, one on real-time benefit check and then another one on an upcoming disease state, and really preparing our management strategy, looking at the upcoming pipeline for that disease state, and both of them did a fantastic job.
And next, we'll run through some of the block rotations, which will take up each calendar month, starting with the formulary and UN management rotation. Kyle, if you're able to provide some details on that.
Yeah, sure. Thank you, Max. After orientation, this was actually the first rotation that I had. So just to kind of run through this, some of the things that you can expect to learn from this rotation are formularies are developed, learning how to implement formulary changes. So lots of work in terms of pharmacy utilization management. I know one of my major projects during this rotation was actually looking at our current usage of multiple sclerosis medications, and then just doing a complete review and seeing, if there are any changes that we need to make to our current utilization management involving MS drugs, and then made recommendations to the team accordingly. On this rotation, you can also expect to do another project, which is our Market Watch presentation. So basically, you'll be taking a look at the pipeline of drugs that, in this case, drugs that will be on the market in about 6 months, and basically just prepare the pharmacy team for what's coming. What evidence is behind these drugs? How successful do we think they'll be on the market, and what role do we think they'll play in current therapy? So those are the considerations that you'll take into account for that project. And then you'll also work with one of our clinical pharmacists, Dr. Eric Guyette, on medical policies. So you'll be updating existing medical policies, as well as he tries to give you the opportunity, which I got, to create new medical policies on your own as well. So that was a really cool project as well.
Alrighty, the next rotation we'll talk about is the clinical operations rotation. I would say this goes very hand in hand with the utilization management and formulary rotation, in that a lot of the design policies and reviews that are decided upon in that department are now carried on through the operations team on how we code these benefits with our pharmacy benefit manager. And so this is pretty important in order for our members to be billed the correct amount and for the medication that they're promised. And you also work with, like I said, the pharmacy benefit manager, but also get to learn more about how different specialty and benefit managers and considerations that we take when partnering with them. Next rotation is the pharmacy administration rotation. I particularly enjoyed this one just because it had a lot of business components intermixed with it. You follow a lot of the executive business decisions that are being made and all the considerations that we take into account when we file with different benefit managers for the pharmacy and medical benefits, but also in the specialty space and all the rebates and contracting talk that goes around that. Next is the Medicare rotation. Our Medicare team is rapidly growing, and through that, we're having provider networks interested in collaborative drug therapy protocols. And so one of my tasks was to draft those agreements so that we can start billing Medicare in our provider networks. Another thing regarding concepts around HEDIS and STARS ratings, so doing a lot of patient outreach in order to get those ratings up and to make sure our patients are meeting their outcomes and target goals. So any level of individualized patient management that you enjoy, you'll be able to be exposed to that here, especially through the NTMs. And then we touched on this earlier, that our prior authorization review is our longitudinal duty, which averages around 15 hours per week. Fridays are designated for PA days, and then residents will alternate weekends for coverage on the PAQ. And then Kyle, if you're able to highlight some of the teaching and precepting opportunities that come with being a resident here.
Yeah, so I can definitely say that there's no lack of opportunities when it comes to teaching and precepting and practicing those skills. So one of the ways that you can practice these skills is that we have APPE students rotate with us, usually on a monthly basis. So we're in charge of basically making sure that the students have all of the resources that they need. We help set them up with meetings to meet and greet with the various pharmacists that we have on the team. We make sure that they are producing satisfactory work and that they're keeping on top of their projects. And then we also are in charge of evaluating their performance at the end of their rotation. So really a great experience. And I know that Max and I have really improved our ability to precept students from this experience. There's also the opportunity to present a lecture at UW managed care electives. So I know that this year Max and I presented a lecture on monographs for UW students in their managed care elective that they did. I know that was a great experience for both Max and I. Another great opportunity that you have with the Premera Residency is completing a teaching certificate program through the University of Washington. And I know that that's an opportunity that both Max and I have decided to take advantage of. So with that, you'll have some nightly sessions where you'll attend lectures that basically go over concepts within leading classroom instruction and becoming a better teacher. And then they also give you the opportunity to facilitate classroom discussion and actually lead a class of your own. So I've actually been involved in that this quarter, and I've been helping facilitate classroom discussion. I've been involved in content creation for a skills lab at the University of Washington for P2 students. So that's been a really rewarding experience for me. And then Premera does pay the tuition for this teaching program. And then if time is required off of work for this program, Premera provides for that as well. So like I had mentioned in the beginning, definitely no lack of opportunity when it comes to teaching and precepting at our program.
Thank you. And John, if you're able to highlight some of the patient care rotations that we have in both the fall and the spring.
Sure, and to piggyback on what Kyle just said, the UW is in the middle of a major curriculum revision. It's a totally different way that we're teaching. We're right in the middle of that changeover now. So there are a lot of interesting things going on. It's interesting to see the difference between the students in the new curriculum and the ones in the old one. Residents next year will still get to see that in progress because it won't be completed until the following year. So the patient care rotations, there are 2 months worth of that. And one of them this year is at a local Walgreens specialty pharmacy. They, of course, do a lot of mail, but they also have some walk-in patients there. And the second rotation, excuse me, will be actually not at the Polyclinic this year, but at the Everett Clinic, which is part of, both are now part of the Optum system. So that will be the principal site, and that will be a mixture of different activities. I've just seen the draft of that. It looks awesome. And a nice opportunity there is that you'll get a chance to spend a bit of time with the pharmacist that we were working with at Polyclinic last year, who's been promoted. So she's now at the national organization level of Optum. And she has a project for residents to work on in connection with her national P&T and quality work. So I'm looking forward to that. I just met with them yesterday, and totally impressed with what they're putting together. This is an important part, even if you're not planning to be a clinical practitioner ever. Those are core skills, and I advise learning them well and keeping them alive. You never know when you might need them, the way the world is changing these days. I've never been sorry that I did that.
All right, thank you for that, John. And next we'll go into a discussion of our elective rotations. Emily, if you're able to provide some highlights here.
Yeah, absolutely. So during my residency, I was able to spend a month at the Institute for Clinical and Economic Review, or ICER, and had the opportunity to work on their treatments for peanut allergy report and contribute to that report, which was honestly just a fantastic experience. Also had the opportunity to help the pharmacist who looked at the pipeline and surveyed the pipeline to help them prepare information about drugs in the pipeline, as well as put together a weekly email for the internal staff on key articles, new information that's relevant to their work. And so overall, it was just an amazing experience. Got to interact with absolutely incredible people. And Kenneth Garcia and Mei Huang, our previous residents from last year, also had the opportunity to spend a month with ICER as well. Wanted to touch briefly on the University of Washington. My co-resident, Jared Tate, got to spend the month of March during our residency with the UW Outcomes Research Department called Choice, and had the opportunity to work with them to refine and perfect his hemophilia model.
Thank you, Emily. Then John, if you're able to highlight our AMCP partnership with Virginia, the foundation there.
Sure, we are very proud of that. It's one of the most differentiating features of this program. It was a novel idea when we started it, but as I said earlier, I have been working with the foundation since they were FMCP and all the way back at least 15 years. I really appreciate their vision for training the next generation of managed care pharmacists and basically raising the bar for us in terms of practice standards. I am, Emily, when I'm done, if you'd like to say a couple of words about your experience there, which you see Emily and Jared on the scene at that time. The residence or the rotation there is a great opportunity to see the inside functioning of a professional society. There are some careers for pharmacists in that space. They go all the way up to the current CEO of ASHP as a pharmacist. So it's a pathway you probably haven't heard about, and it takes, I can tell you from experience, it takes a lot more to run one of those organizations than what you see when you just go to the meetings. And it's also an opportunity to be in DC where everything is happening, have some good network opportunities there. Emily, if you want to finish that off, tell them what you experienced.
Yes, absolutely. And, you know, honestly, I felt really fortunate during my residency to go from such a great rotation in Boston with ICER to a month back at also another great rotation back in Seattle, and then going to a month rotation at AMCP in Alexandria, Virginia. And, you know, the folks at AMCP are just incredible. They're amazing people to work with and to learn from. I had the opportunity to attend public meetings, congressional meetings, and other meetings on the Hill. Had the opportunity to meet with some PBM lobbyists and lobbyists for other focus areas within managed care. Had the opportunity to work on supporting proposals for upcoming webinars hosted by AMCP, and also had the opportunity to virtually Precept and Intern, as well as other various projects that really helped me understand to a better degree the way that federal and state legislation impacts our work as managed care pharmacists.
Excellent. Thank you both for that. And then next, we have a list of questions that are commonly asked about our program as well. Starting with, does your program have any rotations where you can develop skills towards pharmacy leadership roles? John, can you take this one?
Sure, we have the required administrative rotation gives you a chance to spend some time with the leadership of our department, as well as get a peek into the strategic planning process. This is something that pharmacy was probably the first department at Premera to have its own strategic plan. It's normally a 3-year plan, and it gets updated every year. So this is an opportunity to see basically how we think about that, how it's impacted by the outside forces that are, of course, rapidly changing around us. And that's honestly, I am struggling to know what that world is going to look like 3 years from now. So it's very important to see it updated regularly. There also is a proposed rotation for the elective slot that would involve working with some of our executive leadership. We haven't had anybody take advantage of that yet. There is only one elective rotation, so if you were to do that, that would mean that you would not be able to go to ICER or the UW. The AMCP rotation is not an elective, that's required. And a question that was asked yesterday at our showcase, the Premera will pay travel and expenses for those 2 off-site rotations if you do the ICER, and when you do the AMCP. Normal procedure is that you find a B&B to live in, and so we will pay for the rent on that and your fare.
All righty, thank you. Next question is, do you have any disease management / MTM programs at Premera? And I can take this. Just in relation to the Medicare rotation is where you'll see sort of the individual care management side and MTM opportunities to reach out to patients to do complete medication reviews and also make sure that they're on certain medications for their outcomes. There are also case consultation sessions, which happen about twice a month. This is an interdisciplinary meeting where people from the medical director side, from the nurses side, and also the pharmacist team will join heads and bring some complex case reports, and we'll take all the different considerations in order to help that specific patients and to sort of bring all the resources together that are available in the company. Next question is, my primary interests are informatics, education, and critical care. What does your program offer in these areas? John, if you're able to take this one.
Sure. So the answer is yes and no. We have a great informatics team. It's our corporate data and analytics. There are over 100 people now on that team, and some very smart ones who know way more math than I ever will. They're working with some creative AI and other tools to help us manage more specifically, to provide more individualized patient management. And as Max said, we're also working to expand real-time electronic connectivity with key providers. Education, I think we've already addressed. It's a great opportunity. We have one of the top 10 pharmacy schools in the country just a few miles down the road. And frankly, Premera wouldn't be what we are today without them, certainly in the pharmacy area. Critical care is not really something that managed care residencies normally offer. We don't really have any specifics in that area. even the project possibilities are pretty limited because payers in this world don't manage critical care. It's something that's normally managed at the provider level. That said, there are places that you can go if that's what you're primarily looking for. Some of the residencies that Kaiser, for example, would offer you that opportunity, as well as getting some managed care background also.
Alrighty, and then the next question is, how do resident projects get assigned? Will residents be able to pursue projects of their interest, or are they assigned to the residents? And Kyle, if you're able to shed light on this one.
Kyle, you're muted.
Sorry about that. Yeah, so I can talk about this one. So basically for this, John will get together with the pharmacy team and with management and basically brainstorm ideas of, what does Premera currently need? What value can a resident, work on in order to bring value to the company? And so I know that for Max and I, before we even started our rotation, John came to us with a list of ideas that he was working on and a list of projects that Premera had come up with for us. And he had taken into account both of our backgrounds. He took into account my MBA. He took into account the experiences that we've had before coming to the residency, and he kind of had recommendations as to which projects that we might be interested in. And I know that there were definitely projects on there that fit both Max's interest and my interest as well. That's how we got the current residency projects that we're working on. And then I think John can talk more to this, but if for some reason with the list of projects that you're presented with don't meet any of your particular interests for some reason, I think that there is a process that you can go through to develop your own ideas for a residency project, and I think John and the team would be happy to work with you on that as well.
Yes, and no guarantees on that, because if you want to do that, you have to move pretty fast in a one-year residency. But you would need to develop a business case for your proposal essentially and sell it to the department, which is a good exercise in itself. It's something that could potentially add value for us in a way that we haven't thought about, but you'll have to do the convincing. Now, I can say that I did that myself when I was a resident. However, as I said, it was a 2-year residency, so I had more time in which to pull it off.
Alrighty, thank you. And I believe this next question is in regards to the teaching roles that are, or opportunities that are available in this program. And I believe we touched on multiple opportunities available for that. So. And the next question is a very realistic question asking, is there housing close to or walking distance to Premera Blue Cross for out-of-state residents? And I guess I could take this. Kyle and I myself are found apartments about 10 minutes driving distance from the campus. As far as I know, there isn't any housing complexes within walking distance, but there are public transport opportunities, and so those might be some options that you can take as a transplant.
Yeah, there are, and we talked about this a couple of days ago, and I actually was on campus and checked it out. There are complexes that are roughly a mile away. There is a trail, walking, biking trail that goes along there, although there are warnings about walking on it alone. Biking, I would think, would be safe. But the chances are that the places I'm aware of are probably going to be out of your price range.
Alrighty, thank you for that. And then to close out, we'll go over some of the key highlights to focus on for the application as students gear to submit those.
Yeah, so I can go ahead and take this one, Max. So for the program application requirements, it's pretty similar as all other ASHP accredited programs. So it's done through PHORCAS. Our particular application deadline is 12/31 of this year, so just keep that in mind. Standard for most ASHP accredited programs, you do have to be a U.S. citizen or permanent resident. We require that you submit a letter of intent with your application, as well as 3 letters of recommendation. Transcripts are required, as well as an up-to-date CV. And then if you are accepted to the program, we do require that you're able to pass your NAPLEX exam and your Washington State Board exam as well to get your license by the end of September.
And that is a standard ASHP requirement too. Obviously, you can't do some of the things if you're not licensed.
And then some highlights about the interview process in general. There's a preliminary screening that happens in January, and then 16 interviewees will be invited. And I think obviously for this year, it will be virtual due to COVID precautions. And we typically get about 50 applicants per year, and 2 final positions are awarded. The interview process also involves a short presentation, and you'll get sent a topic list, or you can also propose a topic for that presentation as well. And then some outlines for the application components. Obviously, the letter of intent. This is your opportunity to sort of verbalize some of the key highlights from your CV or experiences that have really influenced you as a professional, or how made your trajectory to where you are right now. Letters of recommendation are something that we also weigh pretty significantly. Obviously, to have a professional in the field be able to vouch for your work ethic and your ability to be a team player and whatnot within an organization is huge. Career goals aligned with the program. This is also ties with the letter of intent, where you are able to sort of express how your career goals aligns with the company mission and whatnot. And then you also hear this a lot with the residency process, is the organizational fit. The interview process is 2-way. Obviously, the candidate wants to make sure that the company is going to offer the residency curriculum and education that they want, but also the company has to see value in adopting that candidate. So those are things to focus on as you close out your residency application for this cycle. And we will leave you with some contact information. If you do need to reach out, we welcome those questions. And once again, we want to thank you for taking the time to get to know our program a little bit better. I, for one, as a resident for this year, can vouch for the level of support that I'm getting and the amount of that I'm learning throughout the short time that I've been here so far. And so with that, thank you again for your guys' time.
Thank you. Bye, everyone.
Thank you, everybody.
Thank you and goodbye.